breathing. It's kind of funny, right? It's the very first thing we do when we enter the world, and it's the last thing we'll ever do. It's so automatic, so fundamental that we just never think about it. But what happens when that system, that perfect rhythm starts to break? That's what we're going to explore. What happens when our ability to breathe fails?
So that's what we're going to dig into. We're going to dive into the surprisingly complex world of lung disease and what's called respiratory failure. We're going to break down how this incredible system can go wrong and, just as importantly, how doctors figure out exactly where the problem is.
So, here's our game plan. We'll start with a really simple way to think about the lungs. Then we'll look at the two big ways things can go wrong. After that, we'll see what happens when it becomes a real crisis, and finally, how doctors piece it all together.
Okay, so to really wrap our heads around this, it helps to stop thinking about the lungs as just organs. Instead, let's think of them as a mechanical system. You've got a set of pipes, those are your airways, and they lead to millions of tiny little balloons, the alveoli. And the whole thing is powered by a pump, your chest wall and all those breathing muscles. Pipes, balloons, and a pump. Got it?
Now here's the cool part. For all the hundreds of different lung diseases out there, it really just boils down to a failure in one of two fundamental ways. It's either a problem getting the air out, or it's a problem getting the air in. That's pretty much it.
And this slide right here is the absolute core of it. On one side, you've got obstructive disease. That is an airflow problem. Think of it like clogged pipes. On the other side, you've got restrictive disease. That's a volume problem. Think of stiff balloons that just won't inflate properly.
All right, let's tackle that first category, obstructive disease. This is all about what happens when those pipes get clogged up.
So the key thing to get here is that the airways are narrowed or blocked. Air can get in okay, but it gets trapped because you can't breathe it all the way out. Imagine trying to squeeze a full water balloon empty through a tiny little coffee stirrer. It's slow, it's hard work, and you can never quite get all the water out. That's air trapped.
And yeah, you've probably heard of a lot of these. They're the usual suspects. COPD, that's the big one, which includes emphysema and chronic bronchitis, is the classic example. Asthma is another one we all know. All of these are conditions where the main problem is getting that air out of the lungs.
Okay, now let's flip the script. Let's forget about the pipes for a minute. Now the problem is with the balloons themselves, or maybe even the pump that's supposed to inflate them.
With restrictive disease, the lungs are, well, they're stiff. The technical term is decreased compliance, which is a fancy way of saying they can't stretch and expand like they should. So you see the difference? It's not an airflow problem like before. This is a volume problem. You just physically can't get a full deep breath in.
And what's really fascinating here is that this can happen for two totally different reasons. The problem can be inside the lungs, what doctors call intraparenchymal. This is when the balloons themselves are bad. Maybe they're scarred up from something like fibrosis. Or the problem can be outside the lungs, extraparenchymal. The lungs are actually fine, but the pump, the chest muscles, is weak or restricted, maybe from a neuromuscular disorder. Bad balloons or a bad pump.
Okay, so we've got these two big categories of chronic problems. But what happens when the system gets pushed way past its limits and goes from struggling to failing? That's when we get into what's called respiratory failure.
Respiratory failure isn't really a disease on its own. It's more like the end result, the point where the whole system just can't keep up anymore. It's when the lungs can no longer do their two most critical jobs. Number one, get enough oxygen into the blood, and number two, get enough carbon dioxide out.
So when a patient is in this state, the very first question a doctor has to ask is, what kind of failure are we looking at here? Because believe me, the answer completely changes how you treat it. And it all boils down to two main types.
First up, we have type 1 or hypoxemic failure. The name tells you everything you need to know. Hypo means low, and oxemic is about oxygen. So, simply put, this is a low oxygen problem.
And then there's type 2, hypercapnic failure. Again, the name is the clue. Hyper means high, and capnic refers to carbon dioxide. So this is a high CO2 problem. Low oxygen or high CO2.
Okay, so we have all these categories, right? Obstructive versus restrictive disease and type 1 versus type 2 failure. So how in the world do you connect the dots and figure out what's actually going on with the patient?
This is where the rubber meets the road, with data from a breathing test, or a PFT. Look at that first row. There's this key number that basically measures how much air you can blast out in 1 second. If that number is low, it's a dead giveaway that air is getting trapped. That's your classic clogged pipes, obstructive disease. But if that number looks normal and you look down at the second row, total lung capacity, and that's low, well, that tells you the lungs themselves are small and stiff. Those are our stiff balloons, restrictive disease. The numbers tell the whole story.
Now for my favorite part. How do you remember the difference between those two types of failure we talked about? It's actually really elegant and simple.
Type 1 is an oxygen problem, plain and simple. This means the gas exchange isn't happening right at the level of the balloons, the alveoli. Think about something like pneumonia filling them up with gunk. The pump is working just fine, but the oxygen just can't get across into the bloodstream.
And type 2, that is a pump problem. This is a failure of ventilation. The lungs, the balloons, they might be perfectly capable of exchanging gas, but the pump, the chest wall and muscles, isn't moving enough air in and out. The pump is broken, and because of that, you can't blow off that carbon dioxide and it builds up to dangerous levels.
So, okay, why do we care so much about this distinction? Well, because it's everything. You treat an oxygen problem totally different than you treat a pump problem. Giving a ton of oxygen might help a type 1 failure, but it could actually be harmful in a type 2. For a failing pump, you might need a machine to literally help with the work of breathing. Getting that diagnosis right from the start, is absolutely critical. It's just amazing when you think about it. This whole incredible system of pipes and balloons and pumps just working away every second of every day, completely in the background. It's this perfect, intricate machine that we rely on for our very existence, and it's only when it starts to break that we get a glimpse of just how fragile and how wonderfully complex our own bodies truly are.